Ladies and gentlemen, please allow me to introduce to you Mr. Manish Kohli, a visionary physician leader with a demonstrated history of instrumental roles in pioneering healthcare endeavors globally. Dr. Kohli is passionate about transforming health and care through data, technology, and digital innovation. He's a steadfast champion for better access to quality care for every citizen, anywhere, anytime. And he's known as a global thought leader in digital health and complex healthcare firsts. He's an advisor to organizations and stakeholders globally in the areas of digital maturity, innovation, strategy, governance, change management, and workforce development. Presently, he's the CEO and founder of Beyond Horizon Health, a global digital health advisory and consulting firm. He's the immediate past chairman of board of HIMSS and is a member of the Standards Advisory Panel and also the Joint Commission International. He serves on the board of directors of Wings of Hope, a global humanitarian nonprofit organization that helps the world's most vulnerable communities. Hi, Manish. Welcome to our conversation today.
Good morning, Thomas. Thank you for having me. It's a pleasure to be here.
Manish, it's such an honor to have you on our conversation today. So perhaps to just start with, so in every healthcare system, there are strategic plans on how to digitize healthcare for better patient outcomes. Now, despite this, in a lot of countries around the world, the digitization and transformation process faced many barriers, and transformation was either occurring very slowly or not really at all. What are your thoughts on this?
I think COVID-19 pandemic has been a blessing in disguise, especially for healthcare. One of the things that we've seen is that the increased willingness on the part of governments and policymakers, as well as payers and insurance companies, to actually fund areas like telehealth. And that has been sort of the biggest barrier until now for adoption. We've had the technology for a number of years. And the big question in many markets has been, well, how do we get paid for this? How do physicians and hospitals get paid for the time they spend providing remote services? And with COVID-19, when everybody has been confined largely to their homes, and we've been trying to manage care remotely, there's been a driver. So for example, in the US, the Center for Medicare and Medicaid Services has issued guidance that telehealth visits would be paid. So I think this has created an open door for healthcare, and I do feel that the healthcare ecosystem is going to get recalibrated post-COVID, where virtual health will become an important component of the care patients receive. And for me, it makes better patient experience sense, it makes better economic sense, and it's actually just generally the right thing to do.
Right, I completely agree, and it does make people's lives much easier when we advance in this direction, from the consumer's end at least. Would you be able to mention any specific digital tools in healthcare that are currently helping patients to fight the pandemic and the current situation?
Well, I think there are a plethora of tools out there. Without going to specific vendors and technologies, broadly speaking, there's an increased attention to telehealth platforms, increased attention to remote patient monitoring, especially as you look at detecting, diagnosing and chronic disease management, and this area is going to proliferate. There's also increased attention to the underlying infrastructure that enables the free flow of data and information between health systems and between nations. We have heard a lot about artificial intelligence, and the real promise is in healthcare, or one of the real promises is actually its ability to help us synthesize large volumes of real-time live data and give us insights for better decision making. So I do feel like the different technologies are now coming together to the forefront. And the future is going to mean, even more and more attention to how we measure, monitor, and take care of patients remotely. So, when you're looking at a sensor-fitted garment and you're looking at more comprehensive sensors, that's the future. It's not going to take the place of the doctor or a visit periodically to a clinic, but being able to provide the care to the patient where it makes most sense is really the wave of the future.
Right. So we are gathering a ton of data in this era through wearables and through monitoring and things like that. I think the big question for everybody is how do you make sense and integrate all of this data?
That's the $1 million question. And the reality is, that the data that we house in a healthcare system over a patient's lifetime represents only about 10% of the data for the patient. 90% of data related to patients' well-being and outcomes resides outside the healthcare system. And I think with the proliferation of sensors and devices and remote technologies, we're going to have even larger volumes of data coming in, including social determinants of health, genomics data, environmental data. And my view of the future is that we will have these data streams that will be coming into health systems or data integrating services that are going to then apply data organization methodology, but then tools like artificial intelligence to really glean insights and then deliver them to the stakeholder at the right time for better decision making. And the stakeholder would include a patient. So if Tomas is having a meal in a restaurant and he happens to have, let's say, diabetes, he should be able to simply pick up his smartphone, scan a menu, and the dishes on there, or the dish that interests Tomas the most, would tell him how it fits into his diabetic meal plan. So I think we are going to see a lot more really novel technologies that are going to allow us to detect and collect data, but also then give education and insights to everybody in the ecosystem to make better decisions, starting from the patient all the way to the policymakers. And I think that's what excites me. And that's the only way we'll be able to manage the paradigm of quality, access, and cost, and patient experience.
Right. And how do you think you would incentivize patients in this case in order for you to gather that data properly?
Well, I think there are several levers that one can use. Behavior change is always complex, and ultimately it boils down to how are you adding value to the patient. I'll give you an example right now. For a long time, people said, patients will not be sophisticated enough to use telehealth technologies, right? Or especially the elderly. What we are seeing is, as the need has arisen, patients have been quite adaptable. So I think let's not underestimate the consumer and the patient. I think what we need to do is really from a incentive perspective, create the right drivers. What does the patient get out of it? If the patient is able to seamlessly self-schedule an appointment and have a better experience, you've created an incentive for him or her to use that portal. So if we divert 80% of the volume from calling a doctor's office and making an appointment to actually self-scheduling, you've made a behavior change. So I think we don't have to look very far. Look at the airline industry. They have successfully managed to engage the passengers. Everything from the ticket search to booking, and now even tagging our own bags. And I think in healthcare, we can achieve the same level of engagement with the patient, where we give them control over their health, their information, and their decision making, and we serve as their coaches along the journey. Now, the other thing you can say is really tying risk, right? So if you're rewarding behavior change, so for example, a lot of the self-insured employers in the many countries incentivize patients. If they maintain a BMI that's defined by criteria, they get a discount on their insurance. If you stop smoking, you get a discount on your insurance, or some employers won't even hire you if you smoke. If a hiring decision is made, and if you smoke, you will be given the opportunity to quit smoking, and they will offer you counseling. But if you do not quit smoking, you will not be hired. So I think there are things that employers and insurance companies and policymakers can do as well to incentivize patients to take better care of themselves.
Right. You're absolutely right. It does come down to coronavirus is still ongoing. In some countries, in Slovakia, the situation has been getting better, but of course in the US, it's not quite. I mean, it depends on the location, of course, but the situation is still tough. What should we learn from this pandemic, and how should we transform healthcare to sort of prepare for next situations like this better?
Yeah. I think one of the things that I've viewed as a gift in this pandemic is actually having a chance to reflect. We've all been confined to our homes and have had to sort of adapt to the new reality, at least temporary reality. But as we emerge from this, I think we have to kind of think about what is humanity's relationship with our planet and the environment and the ecosystem that we engage with. The current pandemic is from COVID-19, which is belongs to the family of coronaviruses. And it's a zoonotic infection, which means that these viruses originate in animals, and then they come to human beings. And this kind of transmission is not uncommon in nature. But when you have increased wild animal trade and increased the consumption of wild animal meat, we have increased deforestation. We're not paying attention to the impact we're having on Mother Nature and the environment. It makes us a little bit more vulnerable to pandemics like this, right? So my sense is that if we do not begin to look at prevention from the viewpoint of our relationship with our environment, we've missed a big opportunity. Everything else that we talk about from a technology and managing pandemics is after the infection has already taken a foothold in human beings, right? So I think the first step has to be reevaluating, simple decisions we make on a daily basis, right? Everything from, the amount of meat we eat to, how much air travel we undertake to, how much consumables do we consume and recycle. So all of these things have a bearing. And they have to sort of be reflected not only in our daily choices, but all the way into our policies and funding. Now, let's say we do have a pandemic because, when you look at history, pandemics are not new. They happen quite at a regular basis in humanity. And they've in past had a huge impact on human lives and death, right? For example, the plague, the Black Death, cost us almost 50 million people. So once you have the pandemic, we need to have the public health infrastructure that's going to be able to detect, identify, and mobilize resources to really manage the pandemic before it becomes a pandemic, right? So when you have the animal to human transmission, you get a local outbreak. That is the first step. We should have the infrastructure locally to manage that. If we're not able to manage it and it spreads to a larger geography, then it becomes an epidemic. We definitely should have a robust infrastructure to really contain the epidemic when we see it, right? And then, if we do end up in another pandemic like we have now, there needs to be much more international cooperation and data sharing, and willingness and ability to collaborate in real time in a nimble manner to really address the problem at hand. But technology, I think, is going to play a big role. And we've seen examples how China has managed it. I mean, they've got a very sophisticated, integrated, surveillance network, from facial recognition to, integration of their payment portals and, consumer communication portals like WeChat. They actually were pretty successful in identifying contacts and actually isolating them. And I think, there's always a discussion on privacy versus permissiveness, and I think that's a discussion that needs to be had. But there's a balance somewhere in there, right, where we start looking at our behavior choices, start looking at the privacy issue versus the public health protection, and create an infrastructure that allows us to quickly detect, identify, isolate, and treat individuals. Now, one of the challenges is, right, it's taking us such a long time to develop a vaccine. Why don't we have funding for vaccine development or more robust funding? Why don't we have a better infrastructure so that we can actually reduce the time? And vaccine development does take time, but if we have a pipeline that's ready, we can actually be much more effective. So there's funding that's needed for areas which don't traditionally make a lot of money for pharmaceutical companies. And the Gates Foundation, amongst others, have done amazing work in leading those kind of efforts. So public-private partnerships to really promote research and development in areas of pandemic preparedness. And then what we talked about earlier, right? The digital tools to allow health systems and patients to manage their care. Ultimately, what it boils down to is, are we doing the right thing at the system level, but then are individuals empowered with information to make the right choices? Now, one of the big threats that's emerging now is something we call infodemic, which is the existence of false information that confuses the patient and the healthcare providers. And this is an area that I think is pervasive, because we are seeing it's easy to access good information and not good information equally easily. And the average consumer does not know. So how do we go about filtering and creating channels where we can give the population, the people, the right information at the right time so they can make the best decision? I think these are some important topics that I think that have come out as a result of the pandemic. And I think it's going to keep a lot of us very busy and very excited. I'm very hopeful that this is actually going to lead to a much, much better future for all of us.
Thank you, Manish. Before we close off, do you have any other remarks regarding the situation and digital health in general?
I think one of the areas that I really think about is workforce development. I had somebody just the other day ask me, right? You have robotics coming in and you have sensors coming in. What is going to mean for the future of jobs? And, how do I prepare myself? And I really think that, young individuals who are preparing to embark on a career in healthcare or digital health, I think the sky is the limit. This really is a fundamental turning point in healthcare and digital health. Opportunities exist. We need to step up and, as a society, invest in educational system and skills development. But as somebody who is in training right now, think about what skills you need and what problem you want to help solve. There will always be jobs because, we will be doing work differently. But for skilled people with ambition, attitude, excitement, and innovative mindset, the sky is the limit. So, keep positive. I think collaborate, continue to read, learn, upskill. I think we come together and we have the power to leave healthcare better than we have found it. And I think that really is what excites me as I look forward to stepping out of home and, connecting with my friends and colleagues, old and new, around the world. And more than virtually, in person.
Right. We too also hope that the future of health isn't like this virtually. And thank you once again, Manish. I mean, it's awful that we weren't able to make it to our event this April or last April, but we couldn't be more honored to have you on this fall. So thank you once again for joining us virtually.
Thank you. My pleasure, and good luck.